In deciding whether your child is well enough to attend daycare or to school, there's just a few things that you really have to know. Number one, do they have a fever? Most daycares and schools will not allow your child to attend if their fever is really, I say 101 or over. Some of them are even more restrictive than that. But if your child has fever, that's going to be an indicator that you need to look more closely as to whether or not they can attend. The next step is, if they have a fever, how are they feeling? If they have difficulty getting up, normal energy, running around, they're not eating, they're having vomiting or diarrhea, you're not likely going to send that child to school. In terms of simple common cold, then this is more of an issue, because we know that children with common cold or viral infection are most contagious before they even know they have the symptoms. And so for children with minor runny nose, with minimal cough, who are active, playful, eating well, drinking well, those children can continue to attend daycare or school. Some of the best ways to prevent childhood infections include not only immunizations, but good hand washing is the hallmark. And I know you heard that from your grandma, and I know you've heard that from doctors in the past. Nothing has changed. Appropriate hand washing is something that you can teach a child as young as 1. And if you're at home, using either soap and water, just like at the hospital, or using an alcohol-based hand hygiene product is going to be effective. And you teach your child the hand hygiene using soap and water, singing the birthday song. But just know that you need to actually scrub with friction and soap and water for 15 to 20 seconds. You can teach children cough etiquette from a very young age also, and that's coughing into the elbow rather than into the hand, which you then use to touch other individuals. And so I think the utility of vaccines, plus hand washing, plus cough etiquette, it's probably 3 of the best things that you can teach your child from a very young age to prevent the transmission of infections.